My name is Pascale Allotey, Director of the UN Special Programme on Human Reproduction HRP and WHO's Department of Life Course Health and Reproduction, covering sexual, reproductive, maternal, adolescent health and aging. I want to acknowledge World Contraception Day, which is the 26th of September, and International Safe Abortion Day, which is the 28th of September, both auspicious for the timing of this conference. Translating research into action is about turning evidence into care that saves women's lives. But global health is facing immense pressure, and women's health is often the first to be compromised. For sexual and reproductive health and rights, the evidence is often generated in politically contested spaces. And it is urgent because preventable maternal deaths, unsafe abortions, and unmet needs for contraception, addressing sexual violence and menstrual disorders, and a plethora of neglected obstetric and gynecological conditions remain with us, despite decades of knowledge. We have lots of life-saving evidence that is implementation ready. For instance, on the 5th of October, WHO and HRP will launch a new global guideline on postpartum hemorrhage, the leading cause of maternal death. These recommendations are grounded in landmark evidence, including a WHO meta-analysis of over 300,000 women across 23 countries, redefining how we diagnose and respond to postpartum hemorrhage. This is the largest and most rigorous assessment of postpartum hemorrhage diagnostic criteria to date, and it underpins a new WHO definition for postpartum hemorrhage. This is a pivotal moment in maternal health and ending preventable deaths. In today's world, three main barriers hold us back: politics that silence science, inequities and injustice that continue to devalue women as patients, health professionals, researchers, and leaders, and frankly, a lot of arrogance on our part to be open to new ways of knowing and doing in order to strengthen contextualized implementation and scale up. Of course, financing and investment remain a perennial challenge. Collectively, we need a clarity of focus, an agility of methodologies and strategies, and an indisputable North Star that embeds equity and rights into implementation and scale up. But how do we make this real? We work with governments, academic partners, communities, funders, and other UN partners through critical smart partnerships. We understand that translation is not one way. Action must loop back to research, showing us where interventions work, where equity gaps persist, and how policies must adapt. Without that feedback, research risks becoming irrelevant. If on Monday, governments and partners chose to do just one thing, they should strengthen, leverage, and fund the smart partnerships that demonstrate the value chain of research to scale up of proven, rights-based women's health interventions. Within a year, we could prevent thousands of needless deaths, avert millions of unintended pregnancies, and build health systems that are stronger, fairer, and more resilient.